So I just wanted to make a short video and talk about non-scale victories that I've had here recently that I feel is pretty awesome. My scale victories have been great. I've lost a lot of weight. I'm a much healthier weight. But the non-scale victories, those have been what's really changed things for me. And I'm sure most people have mentioned, the swelling is down, the joint pain's down, all that good stuff. But last year is when I found out I had diffuse scleroderma. One of the things I was trying to get was life insurance. And I got denied. And denied again, and denied again, and denied again. It was really hard to get life insurance. I eventually paid way too much for way too little life insurance. Well, I just got approved for some pretty good life insurance now. And to do that, they had to actually come take blood tests again, Anytime you have what I have, they need blood tests. They need to verify stuff themselves. So, for example, my A1C is 4.7. It's been up as high as 6.4, I believe. But just last year, it was 5.9. Cholesterol is 176. LDL is 123. My HDL is 29. On this test, it's always run low for me. But my triglycerides, now here's a big one, because in May of 2019, my triglycerides were over 300. This test, it was down to 116. There was a test in between these two where it was like 186, I believe. My blood glucose from these tests, it was at 90, whereas, a year ago, it was in the 115 to 120 range. And they take my pulse. My resting pulse rate used to be in the 120s. Now it's in the 60s. When I got it tested, I think it was in the 80s this past time. But my blood pressure, it's every time I get it tested now, it's like 115 to 120 over 70 to 75. So there's also a couple of blood tests that I wasn't as familiar with. Most people probably aren't as familiar with them. But they test for, I don't know if I'm saying this right, but it's an ESR. It's the erythrocyte sedimentation rate, and the C-reactive protein. Those tests, when they're high, can mean you have inflammation. You could have chronic disease or autoimmune issues. I have autoimmune. That's what diffuse scleroderma is. My ESR rate, you want it to be under 10, and mine used to be 33. The test I just did a couple months ago, it's 8. So it is now under 10 where it needs to be. The C-reactive protein, you want that under 10 also. And mine's been up to I think 13, but it was at around 11 last year as well. It was at 4. So, pretty happy about those blood test results. Additionally, with my health being better, I've been running a lot more, jogging, not running. I'm not fast, but it is more than walking. Been jogging this past week. I actually went from, my app had me do 8 minutes of jogging, 5 minutes of walking and 8 minutes of jogging. That was my day. The next time they had me jog for 20 minutes straight, and I completed it. So that was a big deal. I forgot to mention here, the completing 20 minutes of jogging straight without a break. You gotta remember, a couple months ago, I struggled to stand up and sit down. I almost blacked out essentially from a child's, it was at Sawyer's birthday party, the inflatable obstacle course. I almost passed out going through that thing. So that's where I was at. And the day that I did the day I did 5 minutes jogging, and then walking, then 8 minutes jogging, then walking, then 5 minutes jogging. I had that one day last week, but before I went to jog, Sadie asked if we could go for a walk, and I was like, no, I'm gonna go jog. He's like, oh, so you're gonna jog first. So obviously she has confidence in me. She knows I can go jog and then go walk. So that's what we did. As soon as I got back from my exercise, me, her, and Sawyer went for about a half a mile walk. This weekend, I rode go-karts with Sawyer. It is the first time I can remember in, I don't even know how long, well over a decade or two, that I sat in a go-kart and didn't have to ask for the extra lap belt. I actually had plenty of room left, and I got up and down pretty easily in it. The kids we went to the park this weekend. I actually crawled up in the thing with them, with all the tunnels everywhere. Crawled through them, went down the slides, all that good stuff. But probably my favorite non-scale victory this week, after over a year now, of eating this way and trying to find some kind of test results with diffuse scleroderma and eating proper and all that kind of good stuff. I found plenty of results with autoimmune issues, but nothing specific to diffuse scleroderma. But after a year of trying to get this question answered by some kind of doctor that has studied and researched this, I was able to get two doctors to answer it. Dr. Barry and Dr. Hampton at the Proper Human Diet Summit, virtual summit, last week. So that's it for this video, but I'm going to show you right now the question I asked and their answer.
Christopher says, have you heard of people healing from diffuse scleroderma while being on the proper human diet? I feel like it's helped me tremendously, but not sure if it will help it just go away over time.
Yeah, well, I don't have a patient personally. Have I heard of it? Absolutely. My experience has been that autoimmune diseases of any kind heal quite rapidly with this type of diet. In fact, if you think about the person who I just had on my podcast, she actually had an autoimmune disease as well. And this is the amazing thing about her story. Dr. Barry, I'm not making this up. She said within 2 weeks, they were going to put her on Plaquenil, right? One of those immune drugs. Within 2 weeks, she never filled the prescription and her aches and pains were essentially gone. So she had not been able to, she was a nurse and she wasn't able to walk and wasn't able to get around, wasn't able to help patients. So she actually had to work from home, and that's the only thing she could do. So the answer to your question, empirically, absolutely. And actually the diet that may be the most beneficial, to be honest, is the carnivore diet, because you eliminate all of the processed foods in your diet. The inflammation goes away, and for a certain subset of people, it works really well. So absolutely think that's the answer.
Yeah, I totally agree with that. And I would add, Nisha and I, both in the clinic before the fire and now on social media, we have had just a multitude of people with autoimmune conditions reach out to us. And it's kind of funny because when I first started the ketogenic diet years ago, I considered it just a short-term weight loss hack. And so I would put my most morbidly obese people on it to help them lose some weight so they didn't have to have bariatric surgery. And these guys kept coming back to me and they would say, oh, yeah, I've lost 30, 40, 50 pounds, but also my arthritis is better. Does it do that too? And you can imagine me 6 years ago going, no, I don't think it does that. I mean, it's just, it's a weight loss diet. But then I kept having people with autoimmune conditions like scleroderma, lupus, MS, say, you know what? Since I've been doing this keto, I haven't had a single flare-up.
That's right.
I actually didn't refill my Plaquenil or my methotrexate or my prednisone, and I haven't had a flare-up. Does keto do that too? And back then I was dumb. I didn't know the full power of the proper human diet, right?
Right, that's right.
And I would be like, well, I mean, maybe, but I don't think so, but we'll see. But I think at this point, you and I both have heard of so many thousands of anecdotes of people just like that who are like, hey, I don't even go for infusions anymore. And I haven't had a flare up in a year. And when I do have a flare up, it's very minor.
That's right.
So I absolutely think, and I agree with you, I think keto's great for autoimmune conditions. But I think the ultimate form of keto, if you have an autoimmune condition, is probably carnivore,
That's
which
right.
I consider to be a subset of keto. But yeah, anybody with an autoimmune condition, if you haven't heard of keto or carnivore, 100% you need to give it a 90-day
Yeah,
try.
just try it. Just try it.
Absolutely.